What do my labs mean? Have you ever had labs ordered by your doctor and you get them back and you're trying to look online anticipating the results and you see gibberish like this and have no idea how to look at it, and then you Google down a rabbit hole and then you're convinced you're dying? You're not. My name is Dr. John Schmidt, always on call. All right, complete blood count, CBC. Why do we order it? See if you're anemic, see if your blood's too thick, polycythemia. See if you have an infection, maybe you have inflammation, maybe your platelets are too low and you can't make a clot. Here we go. So number one, we look at the top, white blood cell count, WBC. In this case, this is my fake patient. It's normal in this case. Too low, we worry about things like maybe viral infection, maybe even cancer. Too high, we think bacterial infection or sometimes inflammation. So the next couple, the red blood cell, RBC, hemoglobin, hematocrit, three ways to kind of say the same thing basically. How much red blood do you have? And in this example patient here right now, he's a male and he's a little bit anemic, a little bit low, 12.8. Now this scale says 13.5 on the low end, but really important for y'all to remember is that these scales change depending on the particular lab. So if you see something flag abnormal, don't freak out. Give your doctor a chance to explain it to you. Well, let's play along here. So this 12.8 hemoglobin and 36 hematocrit, you notice it's almost times 3. That's kind of the rule of 3 that we have with that. Why is this low? I don't know. Well, let's take a look a little bit further. So the next thing we see is MCV, mean corpuscle volume, simplified version, but that's kind of like a height to weight ratio, a little bit like a BMI of your red blood cell. So a couple of things. In this case, this guy is high, 104. Our normal range is roughly 80 to 100. When it's above normal, we think of things like B12, folate deficiency, heavy drinking. On the other end of the spectrum, if it's too low, below 80, we think like iron deficiency or chronic disease like kidney disease and things like that. So in this one, it might clue us into what we're going to find out later. Okay, so he's anemic. We have the MCV is high on here. Let's go down a little bit, see if there's any more clues. We've got the rest of the remaining blood cells, size and shape is pretty normal. The platelets in this case are normal. That's your ability to make a clot. And now there's a little bit of a breakdown, a sample of a breakdown of the white blood cells. No, those would be off like lymphocytes, monocytes, eosinophils. For example, if you're having a bad allergic reaction or if you had seasonal allergies, sometimes we'll see the eosinophils elevated. So it's kind of a little behind the scenes info on that. But that's the complete blood count in general. All right, comprehensive metabolic panel, CMP, sometimes called Chem 13. Why do we order it? Kidney function, liver function, sugar, salt, a lot of important things. So let's go top to bottom on this one. Sodium, potassium, chloride, and calcium on this patient, all normal range. Looking good there. Then we get down to the next couple things here. When we go to BUN and creatinine and GFR, these are all measures of your kidney function. So the BUN and creatinine are normal in this patient, but guess what? The GFR is not. So 47, it means it's low. That's technically stage 3A kidney disease. So we want to see that GFR above 60. And what it really means is it tells me how many milliliters of urine you can process in a minute. So it's a flow rate basically of your kidneys. The higher, the better in this one. So this is the first stage of chronic kidney disease and it goes down from there. For example, dialysis patients may have a single digit GFR. So let's keep looking. All right, we got the glucose here. Glucose looks pretty good overall. Our fasting sugar, when they take your blood, we want it less than 100. This is 93. So not too bad. The remainder of that, the albumin down to bilirubin, all those things are markers of liver function. So example, bilirubin is a common one we might see abnormal. That's usually because of a few things. Can be gallbladder issues, can be fatty liver, can be some congenital conditions as well. So some other things we're looking at, the ALT and the AST transaminases, those are very frequently abnormal for a lot of reasons. The ALT has to do with viruses. The AST, most oftentimes that I see, has to do with too much alcohol drinking. So you come off a cruise, get your labs tested, your AST is probably going to be high. But if those two things are raised together, a lot of times we can also think of things like viral infection. So importantly with this, talk to your doctor. Don't panic. All right, next up, thyroid. In this case, we're going to go through TSH, T3, T4. Why do we care about your thyroid? Well, it's important. It is a master control center in the body. Can control temperature regulation, weight gain, weight loss, can control dry skin, dry hair, constipation, can make you nervous, can make you fatigued. So let's find out a little bit more. The TSH, thyroid stimulating hormone, is made in the pituitary gland in the brain. T4 is made in the thyroid and it converts into T3, which is the usable form of thyroid in the body. So when you're not making enough thyroid T4 and T3 and your thyroid number is low, your brain says, hey, stimulate. So TSH increases. That's why your TSH is very high when you're hypothyroid, because it's saying stimulate. Now, on the other side of that, when you have too much, like Graves' disease, for example, your thyroid stimulating hormone is low because you have too much T4 and your brain says, whoa, slow down. We don't need to make anymore. So thyroid's a really important function and doctors check it very frequently. Next up, vitamin D. All right, is vitamin D important? Absolutely, positively, it's important. And it is the #1 vitamin deficiency in the world, believe it or not. Vitamin deficiency is rampant. I was deficient in vitamin D until I started taking it. Vitamin D controls a lot of things. It helps process magnesium, for one. Vitamin D also, it can help with depression. It can help with mood. It can help improve fatigue. Most importantly, though, it is for women with bone health. It is good for people with osteoporosis to increase their vitamin D. So we're going to check it. In this level, our vitamin D here is 35. That's on the low end of normal. Technically, less than 20 is really deficient, less than 30 is insufficient. I like to see my patients come in somewhere between about 50 and 70. That's pretty much optimized. Next up, B12. B12 controls a lot of things. It has to do with neuropathy. We always want pregnant women to take folate and B12. It helps the neurologic system. It can help prevent or minimize peripheral neuropathy if it's very low. Like in this case, our guy here has a B12 of 140. So it's very low. So that can also cause you to be significantly fatigued. And if we go back in time here from the beginning when I talked about him being anemic, we've got low hemoglobin. We're macrocytic, meaning large red blood cells. So it tips me off to B12. And sure enough, when I look at it down the line here, I see B12 is low. So we're going to give you some B12 and get that pumped up. Now, B12 range is crazy. Some scales it goes from 250, and in some scales it goes as high as 2,000. So I try to maximize within that therapy group somewhere around 1,000, maybe 1,200, just depends on how you're feeling. All right, PSA, prostate-specific antigen. If you're a guy and you're getting older and you're having some urinary issues, get your PSA checked, okay? So prostate-specific antigen has to do with the prostate. It's a protein located only in the prostate, and when there's damage to the prostate, it leaks out and we detect it in serum. Now, the normal range is something like 0 to 4, give or take, okay? Depending on the scale. So I'm not really concerned when I have a guy who's, let's say, a triathlete or he's a cyclist and his PSA comes in 38, 39, 40, 41, but we can account for that. What makes me more concerned is the change of the PSA. So if I have a patient who comes in 0.5, 0.53 the next year, even though it's less than the threshold, that was a big change that we need to further investigate and do more of a workup. All right, so next up on here is the urinalysis. So urinalysis are pretty simple, actually. In this case, I just gave you an abbreviated in-office version of what we might see. Why check your urine? Well, you have urinary symptoms. That's the main reason. So blood in the urine can be for a number of other things. First of all, we see it a lot in women as one of the first signs of a UTI. You can have blood in your urine. A lot of times with guys or women, athletes, we can see some blood in the urine if you have a little bit of rhabdomyolysis, if you overdid it outside in the heat. We can also see blood in the urine for kidney stones too. So it kind of helps us figure out a pathway of what's going on with you. The other things that are shown in here is the glucose, the sugar in the urine. We don't really want to see that, although we do see it in diabetics. And then the leukocytes in the urine and also the nitrites. Those two things are involved in urinary tract infections, so we like to follow those closely. And typically, if we have abnormalities with that, we would send the urine out for culture. So nothing to panic with this one. And I hope this information is helpful for you. If it is, subscribe. Let's learn together. I'm Dr. John Schmidt, always on call.